Good evening. An ITV News Central investigation has found that every day 60 people are turning up to A&Es across the region with a mental health problem. Not all the A&E departments have staff trained in the area, and campaigners are warning that lives are being put at risk.
Tom Dunning, who ended up in casualty twice in one night after trying to take his own life, says it took 3 years for him to get the help he needed. Rebecca Burrows has this exclusive report.
Tom was on a night out with his girlfriend when he started hallucinating and hearing voices. The next thing he remembers is being in A&E.
I had a visual hallucination. I couldn't remember. I went to cinema with my partner. Had to pull the car over and just broke down. I could see blood on my hands, but there was nothing there. And I don't really remember from that point on to being in A&E. I hit rock bottom, and all I can think about is ending it. And that night I basically attempted to hang myself. So my partner unfortunately found me and got me sorted and got it off me. So I went to the hospital, and all the rope burns around my neck with A&E, and they said, there was a long wait, obviously with the crisis teams, and they gave me some tablets to see me through the weekend, and I ended up taking an overdose with those medication when I came home.
Not all A&Es have staff trained in mental health. The charity Mind claims the system is in crisis and people are being let down as a result.
We often hear of cases where people have called what should be a 24/7 crisis helpline and you can't get through after 5 o'clock on a Friday, or they've been given really poor advice. For example, go for a walk or take a bath when they're saying that they've got suicidal feelings and thoughts. That's just not acceptable, and you wouldn't have that in a physical health setting.
I contacted all of the hospital trusts across the Midlands to find out how big a problem this is. They came back to me with some interesting findings. We found out that in the last 3 years, more than 60,000 people have turned up to A&Es like this one with a mental health problem. That works out at around 2 people every hour arriving at emergency departments across the Midlands. Dr Ben Stanhope is one of the consultants at the Birmingham Children's Hospital's emergency department. He said they've seen an increase in the number of children and young people coming through their doors with a mental health problem.
A lot of the public will not necessarily have a particularly good idea of the sort of resources that are available for them if they happen to be the parent or carer of a child or young person with mental health issues. Intuitively, where is a parent going to turn to at 2 o'clock in the morning if they find themselves with that sort of problem? So I think it's inevitable, and it has been long-standing, that emergency departments are one of those places that they will turn to.
The Children's Hospital is part of a new mental health service called Forward Thinking Birmingham. The partnership means anyone aged between 0 to 25 can access a drop-in centre in the city 7 days a week and a 24-hour crisis line. Associate Director of Nursing, Elaine Cohen, told me what it hopes to achieve.
If you provide really good community services with really good access, as we intend to do with Forward Thinking Birmingham, then you can often avert a crisis or the need to attend an A&E department because the services are out there and they're responding in a timely fashion.
Tom was only recently diagnosed with borderline personality and anxiety disorder, despite struggling for the last 3 years.
Adult psychology would go, I don't know why you're here, so we'll refer you to this person, go to that person and say the exact same thing, and it's taken about 3 years, and I've only just found out I've got to the right place now.
The government has recently increased the amount of money mental health services receive to £11.7 billion. That works out at around 10% of the total NHS budget.
We've seen quite a lot of rhetoric from government and from the NHS talking about giving mental health an equal, a fair share, an equal deal compared to physical health. But the reality on the ground is that couldn't be further from the truth. So people are still really struggling with their mental health. Lives are being put at risk, and we are losing people as a result of services not being available.
A Department of Health spokesperson said,
We are investing nearly £250 million to make sure that by 2020, no acute hospital will be without mental health liaison services in emergency departments and inpatient wards.
Meanwhile, Tom's planning on getting married next year and wants to offer support to others experiencing a similar kind of crisis.
Being through probably the lowest part of my life, I don't want anyone to be where I was, like I say, even my worst enemies. So if I can help anyone, then I'll do what I can and when I can.
As extra cash is promised, it's hoped it'll better prepare A&E staff for people like Tom so they don't have to struggle on their own in the future. Rebecca Burrows, ITV News.
And there's more on Rebecca's investigation on our website, where you'll also find advice on what to do if you or someone you know experiences a mental health crisis. Just go to itv.com/central.
A review